has been a service of United Regional Physicians Group for a couple of years now, but COVID-19 has amped up its popularity. We're talking about telemedicine, a virtual visit to the doctor's office. And in tonight's Healthy You, Lauren Linville shows us how it's easy and convenient, even for those who might not consider themselves, like me, tech savvy.
It's the one opportunity for me to talk to patients right now without a mask.
We use cameras quite often, whether it's to take a picture of the kiddos or snap a photo of your grocery list on the way out the door. Now, it's not every day you visit your doctor through a screen, but thanks to COVID-19, that's become the norm for many.
So we've been doing telemedicine for about 2 years. We were only doing it in a few of our practices, so we were doing it on a small scale. And in March, we kind of just ripped the Band-Aid and we went live everywhere.
People weren't really aware of this option before. They didn't really know that having a telemedicine visit was something that they could ask for.
Dr. Maxine Lingerar is an obstetrician gynecologist. Many of her patients are mothers or working women who have found virtual visits best fit their schedule.
What I'm using it for primarily is things where people want to talk about hormone therapy, and where people want to talk about birth control options, because there's a lot of counseling and teaching in that.
We've seen a really positive reaction from the majority of our patients for telemedicine. We understand that it's not everybody's cup of tea, but a lot of our patients really love the convenience of it. We've seen patients tell us through their comments, I'm doing this visit from my couch in my pajamas. This is so convenient. I don't want to go back to in-office visits.
It's all up to the patient's level of comfort. You can do a telemedicine call with just audio or Lingerar's preferred method of a video call.
Especially if I'm meeting someone for the first time, it's really good to be able to see their face and for them to see my face.
United Regional Healthcare System officials say it's very safe and easy to use. But if you are hesitant to try it out, a service called My Chart Connection can be your guide.
We can actually help them set up an account, teach them how to use the app, and also do a test video visit with the patient. That way, when they have a visit with the physician, they feel comfortable and they know what steps they need to follow.
At the click of a button, it's a modern way to take care of your health for those who aren't ready to return to in-person visits just yet.